So, good evening, everyone. I hope all of you can hear me clearly, and I hope that the slide is visible to everyone. So, let us take a moment to introduce our distinguished speaker for today, Dr. Vaishali. Ma'am has completed her BDS from Sri Sai Dental College, Vikarabad, and she went on to pursue her MDS in Pediatric Dentistry from Government Dental College, Hyderabad, where she passed out as the state topper. Having successfully cleared the Australian Dental Council licensure process herself, she brings with her a large wealth of knowledge, practical experience, and valuable strategies that will surely benefit all of you who are preparing for the ADC journey. So let us give a warm welcome to Dr. Vaishali as she guides us through this orientation session. She's been there and done it. So, ma'am, we would like to hear from you. Please take over the meeting.
Thank you, Karan. I hope I am audible.
Yes, ma'am.
All right. Okay. Hello, everyone. I hope everyone are doing good. And thank you for joining the session. It's so good to be with you all. So, as Karan mentioned, I am Dr. Vaishali. I've done my BDS at Sri Sai College, Vikarabad. Then I did my MDS in Pediatric Dentistry in GDC Hyderabad. At the moment, I am in Melbourne practicing as a general dentist in Melbourne, Victoria. So, we all are here today to discuss about what is Australian Dental Council exam. Yeah. So before we go ahead, just wanted to ask everyone why would someone want to think about the Australian Dental Council exam? So we as dentists, after we finish either BDS or MDS, we start to think upon what next. Some people would like to stay in India. Some people will have thoughts of going abroad. And one such place is Australia and New Zealand. So to begin with, ADC exam is an exam for both Australia and New Zealand. So see, there are three groups of people. Few people after the BDS or MDS, they migrate to Australia on some student visa doing some master's course, like masters in public health, health promotion, few other courses. So they are on the student visa and they do that course. At the same time, they plan to do ADC as well. There are other group of people who find a partner who is living in Australia, and so they would like to migrate as well. Those people would also think about what to do next once they come to Australia. I fall into that category, yeah. And then there are third people who are living in India, practicing in India, but aspire to someday go and settle in Australia. So, be it any scenario, we all want to live a good future, or we all want to live our dream if anyone is aiming to live in Australia or migrate to Australia. So before we go ahead, I would like to discuss my experience first before we begin. Yeah. So when I had a thought of when I had a thought of getting married to the guy here and migrating to Australia, that is when ADC came into my life. Okay, at the beginning, it was very vague. There were no proper tutors, there was no proper guidance. It was very vague for me. Everything was like I was just Googling everything and found my way eventually. But I would say one thing is finding the right tutor or a correct guidance is very much important for ADC. So I am here with MDS CONQUER to help you through the ADC journey. So today I would like to give you an overview of what Australian Dental Council is, what ADC exam is, what is the process, what are the challenges you're going to face, and eventually if you are aspiring to do the ADC, I am here to help you guys. All right. Okay. So what is ADC exam? See, our Indian BDS or MDS degree is not valid. It is just valid in India. So if you want to migrate to any other country other than India, so that is when you have to validate your degree. So Australia doesn't accept our degrees, although we all are qualified dentists. We have to go through a process, which is the ADC exam. to meet the Australian standards, that is the Dental Board of Australia. So it is designed to assess your knowledge, judgment, clinical aspects, and the professional competence. So ADC has three major steps. All right. So after you finish your ADC, you will be eligible to start to practice as the general dentist in Australia. You don't have to study anything. Once you clear the exams, you will be right here starting practicing as a dentist in Australia. All right. So to begin this ADC, so when I say ADC is not just an exam, I would definitely say ADC is a journey. It's not like you will finish it in 6 months, 1 year, and finish. No, it's definitely a journey. All right. And your journey begins once you think about ADC or you aim about ADC. All right. So the first step in the ADC journey or ADC process is the initial assessment. Now, what initial assessment is? Here you will be validating your documents. It's the documentation process. Once your initial assessment is finished, you go to the written examination, which is the part 1, and the practical examination, which is the part 2. Once you finish the practical written examination and the practical examination, that is when you get registered and the skill assessment as well. So you will be registered, you will be an Australian registered dental practitioner. That is, you would get a registration called APRA registration. APRA is Australian Health Practitioner Registration Agency. Once you get the APRA registration, you will be eligible to work as a dentist in Australia and New Zealand. All right. Now, if you can notice here the term registration and skill assessment. When you choose or do your documentation, you would be doing both registration and skill assessment. Here, the skill assessment helps you to apply for the visa purpose. Yeah. So after you clear the exams, you will get a skill assessment form or a skill assessment PDF, which shows your work experience, and that will help you with the visa process. All right, let's dive into the first step. All right. So the first step is the initial assessment. To start the ADC, you have to go to this link, that is adc.org.au. Everything is very clear on the website. All right. Once you go to the website, you quickly access to the general dentist, and that is where these three steps pop. That is the initial assessment, written, and the practical exam. So the first and foremost step we need to do here is to create the ADC Connect account. All right. So when I was doing my exams, I started my ADC journey in around 2022 Jan. All right. So at that time, there was no ADC Connect. I had to do all the documentation. I had to post everything to Australia. All right. But now everything is online. You can do everything in ADC Connect. So you create your login ID password with the ADC Connect. Once you get registered, you get a reference number. So that will be your reference number throughout your ADC journey. Once you create the ADC account, you will be selecting your application type. So what application type is the registration and the skill assessment, all right, for general dentistry. Then it is the documentation and the outcome. So when are you, who are eligible for the initial assessment? Whoever has finished BDS or MDS are eligible to do the initial assessment, and you can do it anytime. If you want to do it today, you can do it today. There is no time frame for it. All right. So you have to submit all the documents. Once you submit everything, it will take around 8 weeks of time. That is the time frame for you to get back the response from ADC. And the cost involved here is 647 AUD. All right. So these prices tend to change every year, possibly a few dollars up and down, never down, up every time. All right. And then the validity is for 7 years. Now, what is this validity? Once you get your initial assessment finished or the outcome is successful, you will have 7 years of time to finish your ADC exams. So that is what is validity is all about. Okay. If you do not finish the ADC exams within this 7 years of span, then you might have to apply again or renew your initial assessment. That is what it is. All right. Okay, so what documents do you need? The first major document is a passport. Your current passport is your major identity. So that is the identity with which all the other certificates will be matched. Okay, so your current copies, all are the copies, current passport copy, a recent passport photo, evidence of change of name. Now, what is this change of name? There was an issue with me as well. Now, whoever is getting married, if they change their name, they need an evidence to change of name. And now the other degrees, like the dental qualification official certificate, that means your BDS or MDS degree, whatever it is. See, personally, I would suggest you to apply with your BDS degree than MDS, because BDS is the basic one. Although you have your MDS degree, it doesn't recognize you as an MDS anyways. So BDS would be the best thing to do. All right. Next is the academic transcript, which will have your clinical working hours. You will be getting it from your university. Then the internship certificate and your registration, either any state registration. All right. Now, coming back to the evidence of change of name. All these certificates, the name on these certificates should match to the name on the passport. Sometimes the surname is completely mentioned in the passport, but we do not mention our surname on these certificates. That was the thing which happened to me. All right. So I didn't know this. I submitted everything. I sent all the documents in post. Okay. And at that time, I scanned all my documents with cam scanner. All right. So I sent everything to them, and they replied me after 8 weeks saying, firstly, the scans are not clear because I did it on cam scanner. You have to do the computer scanning. But now, anyways, if you're uploading it online also, you need a properly computer scanned copies. Okay. The second thing they mentioned was the name on my passport and the certificates were not matching, because my surname was full in the passport, but it was abbreviated in my certificate. So I had to go back to my university and then get a letter saying that both names are matching. And then I submitted to it and it worked out. So you just need to be careful when you're doing this. Once you do it in the right way, everything's gonna go well. All right. And after these certificates, if you have all these certificates ready, then you request for a good standing certificate from your university. So the 1.4 thing one, arrange for a certificate or a letter of good standing. So you have to ask your university people to email the good standing certificate directly to ADC. You shouldn't come in between. They have to send it directly to ADC. And for your information, the good standing certificate will be valid for 3 months only. So once you have all these documents ready, then you say to the registrar of the state to send them to request them to send the good standing certificate to ADC, and then you upload your documents so that everything will be in a good pace to go. After you finish all this, you will have it will take 8 weeks of time for them to come back. Once everything's proper, they will come out with a reply saying that your initial assessment is valid and is successful and you are ready to go ahead with the ADC exams. From that point, you are eligible to give the ADC exam, and the first step of the ADC exam is the part 1 written examination. Okay, so the eligibility of written examination, a valid initial assessment. Okay, and the cost is 2,122 AUD. All right. When I was giving my exam, it was $2,000. Now it is 2,122. So definitely, sometimes the prices definitely they do increase a tiny bit, and they do mention as well. All right. And the part 1 or the written exam is conducted twice in a year, around March and around September. Okay. So if you are planning to give it in period 1, so these are the exam for this year. All right. So if we are planning to start next year, it would be somewhere around these months only, but the dates would change. That's it. So you should have your initial assessment ready until 13th October if you're planning to give it in March. If you do not have your initial assessment ready, like until 13th October, then you can't do it in March. You have to do it in September. All right. So that is the main thing. So what is the process? You apply for the written examination. So See, everything is in ADC Connect. So you go back to ADC Connect, log in. Once your initial assessment is ready, you will get an email saying that you are eligible to apply for the written examination. So you apply for the written examination. You will be doing it on this application period. So they said 9 to 16 December 2024, right? So you will be getting 1 week before a mail saying that the application period is going to start on 9th. Then you can start to apply. I would advise apply on the first day. Don't get confused. Don't fall for these range of dates like 9 to 16. I have so many days, I can do it anytime. No, it's like a hot cake selling very fast. So better be the first person. If you want to give the exam in March, apply it on the first day. All right, so once you apply, probably it would be the time for you to pay your exam fee as well. So you can pay with any credit card, okay, if you're doing it from India. And the first important thing I would like to tell you is you can write your exam or give your part 1 exam from India. You don't have to come to Australia to give this exam. It is an online exam and you can give it from India. All right. After you apply, after your application is successful, you can then book for the examination date. So the booking of the examination date also would be like 2 months before the exam period. You will get a mail. They will say you can book the examination venue. I mean to say the venue. So what venue here is, the exams are conducted in the Pearson VUE centers. In Hyderabad, it's in Begumpet and Kukatpalli. So any of the centers, you can just book when the dates are mentioned. You will get an email as well. Once you book your venue, you will be sitting for your examination then directly, and then you receive your outcome. So after you give your exam, it would take around 6 to 8 weeks, probably a bit more sometimes, to get the outcome. And you will be getting an email after you finish your exam. After 1 month or 1.5 months, you get an email saying that the exams are the results are released for this date. Log into ADC Connect to see your result. So that heart-beating, heart-throbbing thing happens at that time. Yeah. So that is what it is with the written examination. Okay. My thing here is, I passed in my second attempt. First attempt I gave it from India. I gave it from the Begumpet Pearson VUE Center. Okay. I failed and then gave the second time when I came here. All right. Okay, next thing. So what is the basic structure of the first part 1 exam or the written examination? So the written examination is for 2 days. Okay. The first day, morning and afternoon. Second day, morning and afternoon. All right. So it might probably start at 8 a.m. 8 to 10, you have a break of around the rest break of around 2 hours. Minimum of 1 hour is mandatory you have to take. You can go outside the center, have some food, come back, rest, and then get into the center. The second day is also the same. All right. So it's a 2-day exam and it's like completely online exam. You have to carry your passport and any other evidence, second document evidence. It can be any credit card, debit card, driving license, whichever has your photo or a signature. All right. All these will be mentioned to you before the exam. You will get all the rules to follow before it, and no big rules, like the basic things. All right. Okay, so what do you have in this ADC written examination? Okay, so this is a kind of a blueprint. All right. One good thing I would say here is you won't have any like BDS first, second year subjects. No anatomy, physiology, no general medicine, no general surgery, nothing of them. No biochemistry. Yeah. So it's directly your dental subjects here. So these are the disciplines which you have, all right? And these are the percentage of the questions you would be getting. Okay, so how are the questions here? Now the questions here are the scenario based questions. You would have a photo, you will have a scenario mentioned on the screen saying that a patient named blah 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 has come to your clinic, he has this complaint, he has medical histories like this, and all the details. And then there will be 5 questions underneath that scenario. All right. So there will be completely 240 scored 240 questions, like around 56 scenarios you will be having in those 4 papers. Okay. It will be distributed equally. Like every scenario would have around 4 to 5 questions. Depends. All right. And most of the time they will follow this blueprint, sometimes definitely up and down. Okay. But one thing is like very new here is these clusters. All right. So you will have these floor clusters which you have to follow when you're preparing. So they score you according to the clusters. See, we can go all into the details once you like get into this step of written examination. We can help you with what clusters are, how do you can recognize it, and then how you go ahead. All right. And definitely any questions, any doubts, I'm happy to address it at the end or sometimes one-to-one interactions. All right. I hope I am being clear. And if there's any doubts, please write down. I'm happy to answer at the end. All right. So once you finish the written examination, once you have the successful outcome, then you will be eligible for the practical examination, which is the part two and the ultimate step. All right. One more step to the ADC exam result. Okay. So for you to be eligible to the practical examination, you have to have a successful written examination. Okay. Once you pass written examination, that is when you give part two. Okay, so now part two examination is conducted 3 times during the year. There is period one, which is around January to May, period two around May to August, and period three around September to December. Okay, it is conducted 3 times during the year. Okay, and the cost is definitely a bit more with practical. Okay, it is 4775 AUD. But here it's just the exam fee. You have a lot of expenses involved in the second part mainly than the first part. Yeah. So the financial aspect, you have to be a bit concerned during the part two exam. Yeah. So the time frame is like 4 to 7 months from the application period. Like once you get your written examination, then they will say like period one, you are eligible to go ahead with the practical examination booking. You will get an email. So that is when you go to your ADC Connect again. Then you say if you're ready for the practical exam, you say apply for the practical examination place. Then you book your preferred practical session. You sit for the practical exam, receive your practical examination results. All right. So this you do it every 3 times in the year. Okay. So what do you need in the practical examination? What all are there in the practical exam? So the practical exam definitely is again a 2 day exam. First day. So in the practical, you have both technicals and it is a bench test. You don't have to do anything on the patient. You would be doing it on the phantom head or the mannequin. Okay. So the one day would be a technical skills day, the other day would be the clinical skills day. In the clinical skills day, it is what we call as OSCE. OSCE means it's mainly with the communication. So one day you will have like 10 rooms, and in that 10 rooms you have 4 rooms with examiners in it, and like all the rooms have different examiners. The 4 rooms would be a viva kind of a thing where you role play with the examiner. The examiner pretends to be a patient. He will come and you will talk. So that is when there is a one-on-one discussion for 10 minutes with every examiner. The other rooms will test your other skills, like for example, putting a rubber dam or doing pit and fissure sealants, sometimes CPR, syncope, and X-ray, few things like that. Okay. And the other day would be the technical skills day, where you have 6 tasks. Okay. So of which 3 are restorative based and the preparation based. So what do you have? Like if I have to let you know what those 6 tasks are, you will have amalgam filling, you have composite fillings, you have crown prep, you have provisional crown, you have dental caries and endo access opening. So these are the 6 tasks which you will be having. All right. And whenever you're giving that exam, there will be 24 people who will be giving with you. So see, 24 is a very less number. And like people will be sitting to book with the exam. So you have to be very quick to book or to get a slot. So the slot things is a bit complicated, I would say. Otherwise, everything should be fine. You can do it once you sit for it, you will do it anyways. All right. So on the first day, you'll have 12 members. On the second day, you'll have 12 members. Like first 12 members will have first day as technical, second day clinical, and vice versa. Yeah. And just to let you know that for the written examination, if you have to start your preparation, you at least need around 6 months to start your preparation to give a proper exam, like properly go and sit for the exam. So you at least need a minimum of 6 months. And full fledged, you need like 3 months where you sit home and just study and prepare for your exams, okay? And no other job. While for the practical, you definitely need like 6 to 8 months in the beginning for the first attempt. See, in my thing, I passed again in second attempt. Part one also, part two is also I did it in second attempt. Okay, and for part two, you need a home setup. Okay, you have to have your home setup where you buy things like the mannequin and the practicing teeth. So you have to need a continuous, you have to practice well before you go ahead with the exam. So definitely bit financial things involved over here. Okay. Once you complete your examination, that happy day where you get a result saying that you have successfully finished your examinations. And that is what happened to me on 17th of October 2024, when I successfully cleared the examination. All right. So on that day, you get a certificate of completion, which is in front of you with this name here, and the letter, that is the ANZSCO letter, which you get it from the ADC for the skill assessment and migration. So this will let you know, like this will show you based on your documentation how much years of experience you have. So when you apply for jobs also, you can use that letter. And at the same time, this will help you with the visa process as well. All right. So after, like, once you have this certificate, then you are eligible for, so this certificate doesn't mean that you are APRA registered. You have to apply for APRA registration. All right. So what are the future aspects of after ADC? All right. So you apply for the APRA registration, where you need these documents. Firstly is the ADC certificate you have, Australian trim, all these will happen anyways, okay? And yes, you have to give an English exam. I don't know what sense it makes for them to uh, like for us to give English exam, although we're doing all this hectic process in English, but they want us to give the English exam. Okay, so this is the English exam we have to give, either PTA or IELTS, but it's a very minimum, bare minimum score for like 6.5 everything, which every one of us can do it. All right, and a properly formatted, say, CV or curriculum vitae. There is a bit of application fee as well, and you would get your APRA registration within 4 to 6 weeks of time. Once you get it, you are eligible to start applying for jobs. All right. Now, I know most of them have this like this main question in mind, like how to settle down in Australia, in what way we get the visa or PR or whatever it is. All right. See, in my case, I got married to a guy who had a PR, so that was not an issue for me. I applied for the PR on his name. But there are a lot of people, as I was talking in the beginning about the three groups of people. The first set of people who come with some course here, like they come here with some masters, doing some masters in like public health. They work at the same time. See, I also worked as a dental assistant when I came here. Okay, I used to work part time as a dental assistant, which will give you a very good exposure. You tend to learn a lot of things. You will know how things are happening in the clinic, how the clinic works, how the infection control works, how the dentist, you stand beside the dentist and assist, right? You watch what the dentists are doing. So you learn a lot when you are working. Definitely you make some money, right? So it's a good thing. So when you are coming here, you can always work part time and then do these exams so that you can support yourself financially as well. Yeah. So people who are coming to do with some master's degree, they have some student visa in their hand. And so they can apply easily for PR, however it works out for them. But for people who and whoever is getting married to the spouse who or who's a partner here with the PR, they can apply on that name. But for the people who are in India but aspiring to come to Australia, they can give their part 1 exam in India, but if after they clear their part 1, if they have to come to give, so the practical exam you have to give it in Australia, okay, and in Melbourne. Only Melbourne has the ADC exam center, no other place, okay. So people who are living in other places like Sydney, Adelaide, Brisbane, whoever, wherever they are, they have to come to Melbourne, stay in Melbourne, give exam, and then go. So, likewise, people who are living in India who have cleared their part 1, and if they want to do their part 2, what they have to do is they have to have a home setup. They definitely there are few coaching centers you can order online with all the mannequin and stuff. Have your home setup ready, and before you plan to give your part 2, you have to come to Australia. You can apply for a visitor visa or a what do you call it? Yeah, visitor visa, and then you can come on that visitor visa, the visitor visa or the travel visa. Yeah, so that will be valid for 3 months. Sometimes you get it for 6 months, sometimes you get it for 3 years. You have to mention the proper reason why you're coming here, and then with that visitor visa you can come here, arrange your there are places where people help with the stay as well. Here they are very supportive, so you can arrange for your stay, then the course, and then give your exam. All right. After you give the exam for these kind of people, all right, as I said, the skill assessment part, after that skill assessment, I would personally advise you to have someone called as a registered migration agent. So you have to book in with few agents who will help you with the visa purpose and then eventually PR. All right. So the black highlighted thingy, whatever I put it here, that is just from Google. Okay, I just Googled and put it here for a basic information. But after you finish the exam, there are always good ways where you can come here and get your PR eventually. Australia needs dentists. There is a deficiency of dentists and they need dentists. All right. But the only thing here it is, if you are applying for a visa, you would be mostly applying for a sponsorship visa, mainly in the regional areas for the first 2 years. Okay. So these regional areas are like, what do you say? It's not in the city, but the places around the city, the clinics. So how the work life works out here is there are many dental offices or private dental or corporate dental clinics which work. They offer you the sponsorship to stay here. So once you start working, you have your sponsorship visa for 2 to 3 years, and eventually you apply for PR. And that is how most of the people, there are a lot of people who have come like that and settled down as a dentist with the PR here. So it's not tough. Definitely things work out once you are here at this stage. Okay, so now to cover to come to a detailed things of like after we finish so much of talking and so much of information, what are the major challenges you would face in this ADC journey? Firstly, ADC journey is a time taking process, but trust me, I felt I am here. I went through all this ADC journey, and now the life I am living after the ADC exam is just wonderful. Trust me. The work life here is very good. All right. Whatever you're putting, the money you're putting in the exam is worth it. It is just like an investment. Now in India, if you're planning to have a clinic, you definitely have some put some money to and add some investment right there to put a clinic, establish your clinic, right? That is all the effort and the money you put in. That money you're just putting in the ADC thing. You are investing in the ADC exam. It's definitely an investment, and it's a very fruitful investment, trust me. Yeah. So the major challenges here is firstly the correct guidance. You should have a correct guidance and learn from people who are living and practicing in India. There are a lot of tutors who are in India or who are somewhere else, not practicing in Australia, but then they are just teaching. Okay, They don't know how things work out in Australia. Now, I am personally living here. I am going to the clinic, working to the clinic, seeing patients daily. Yeah, so I know how things work out here. So I can let you teach you or guide you in a more practical and a clinical way. All right. So correct guidance is very important. Second thing is you have to unlearn few things and you should be open to new learning. See, whatever we learn until the BDS or MDS, few things you have to unlearn because you have to learn it in the way Australia wants. Like they have their proper guidelines which they want us to follow. And that's fair enough because you are treating here people like who are living here. Say they want you to follow what they want to, like their guidelines, right? So you have to sometimes unlearn few things and be open to the new learning. Third one is the time factor. Definitely, as I said, ADC journey. It's not like an overnight thing. Definitely takes time, but definitely it's not impossible. It will just happen for sure. If I am here and if you guys are in here, you will be here someday for sure. And then the financial support for sure. Yeah, the part one until part one is definitely manageable from, but then part two you would feel that bit financial glitch. Yeah, so you have to have a bit sorted finances before you get into it. Yeah, but definitely an investment, as I said. And then the home setup and practice. You have to practice a lot and then give the exams and these travel stuff. How to travel, where to go, how to stay. In all these things, I can definitely guide you guys. I can let you know where to go. Whenever you have a problem, you can just drop into a personal, you can contact me personally. We can have a one to one session and I can solve any of your doubts. So, to conclude, see, ADC journey requires a strong determination and commitment. All right, it needs hard work, consistency, and financial investment, but it's gonna truly transform your life. And if I have to wrap it up in a single line, life after ADC definitely gives you a work-life balance. Yeah, you have good work ethics, work life. You will have definitely good money. You will have good bank balance. You will have peace of mind, and you will live your life which you are dreaming about. Yeah, so definitely a good one and a worth thinking it. Yeah. All right. So thank you for listening to me. And I hope I was helpful and I hope I answered any few of your doubts, at least in your mind. But you have any doubts, you can contact to these numbers displaying for more details and we can have a personal one-to-one chat or one-to-one discussion once people are interested and I'm happy to help. Thank you.
Thank you, ma'am. That was truly a very good session. We'll talk to the students and get back to you with further doubts, ma'am. We can solve that on a one-on-one basis. So everyone, please make a note of the below numbers. You can contact us regarding ADC on this number and we'll get you in touch with the respective mentors. That's it for today. Any further queries, please contact us. Thank you once again, ma'am. And thank you everybody for joining.